So I used to have white coat syndrome. I used to be absolutely terrified of anything medical procedure. I would pass out at doctor's offices in the waiting room. I would pass out at blood draws. So I can empathize. Things that worked for me. One was really diving into educating myself about what was happening with my body and what was going to happen. And then practicing mindfulness, breathing, and relaxation. It made a massive, massive difference.
So what I routinely do is anyone I think where blood pressure is going to be a problem, I ask them to get a blood pressure cuff, and I show them how to take it, which is at least 5-10 minutes of rest while sitting down, both feet on the floor, check both left and the right, and use the one that's higher. That it is really important to understand the overall picture of what's going on. Problem is providers will react to those high numbers in the office, and often that means intervention.
Yeah.
Blood draws to additional testing for the baby, and then often someone will say, hey, you need to be induced because of high blood pressure. So I think it is so important to educate the provider about really what's going on.
Right.
And it's not just 1 or 2 blood pressure in the office. Good clinical picture will allow sound judgment for both the provider and the patient. Because otherwise, often you see induction at 37 weeks.
Yeah.
And then that's like 5, 6, 7 days of hell, and then C-section.